What is going on, wonderful people? It's Medicosis Perfectionalis, where medicine makes perfect sense. Welcome back to my physiology playlist. In previous videos, we talked about physiology of the cell and the cell membrane. We talked about cell transport, including osmosis. We talked about autonomic nervous system physiology. We talked about nerve physiology and the action potential. We talked about muscle physiology and the neuromuscular junction. We talked about gastrointestinal physiology. We talked about endocrine physiology, respiratory physiology, reproductive physiology. We talked about all kinds of physiology. Today we shall continue the series on cardiac physiology by talking about the baroreceptors and the baroreceptor reflex. What does the word baro mean? It means pressure, from whence we get the word barometer, which is used to measure pressure. So baroreceptors are receptors that feel the pressure. What kind of pressure? Your blood pressure. What kind of blood pressure? Arterial blood pressure. And these receptors will give that information to the brain, and the brain will decide what to do. Should I increase the heart rate or should I decrease the heart rate? And much more. Click the like button, click the subscribe button, and let's get started. This is my physiology playlist. Please watch these videos in order for maximum understanding and retention. Let's review some neuroanatomy. Remember that you have 12 pairs of cranial nerves and 31 pairs of spinal nerves. The 12 pairs of cranial nerves are arranged like this. The first and the second cranial nerves come from the forebrain, 3 and 4 from the midbrain, 5, 6, 7, and 8 from the pons, 9, 10, 11, and 12 from the middle. 1 is olfactory, 2 is optic, 3 is oculomotor, 4 is trochlear, 5 is trigeminal, 6 is abducens, 7 is facial, 8 is vestibulocochlear or steatoacoustic, 9 is glossopharyngeal, 10 is vagus, 11 is accessory or spinal accessory because it has a cranial part and a spinal part, and 12 is the hypoglossal. Which nerves are we concerned with when we talk about the baroreceptor reflex today? We're concerned with 9, which is the glossopharyngeal nerve, and cranial nerve 10, which is the vagus nerve. Glossopharyngeal and vagus. Why do we call the glossopharyngeal? Because it's for your tongue, glosso, and for your pharynx, pharyngeal. Why do we call the vagus? Because it's vague. It's a wanderer. It wanders around the body, starting in the brain, which is in the head, then the neck, then the thorax, and even the abdomen. But not the pelvis, because in the pelvis it will be replaced by the pelvic splanchnic nerves, otherwise known as nerves erigentes. Let's review some cardiology. This is your heart. Here is right atrium, right ventricle, and left atrium, left ventricle. From the left ventricle emerges the aorta. We have ascending aorta, aortic arch, and descending aorta. The ascending aorta will give us the two coronary arteries, right coronary artery and left coronary artery, to supply the heart itself. And then the aortic arch will give us 3 famous branches that you should never ever forget. I should be able to wake you up from a coma, and you should still remember the names of the 3 branches of the aortic arch. If I got stabbed by a knife and came to your hospital to treat me, before I give you permission to do anything, I'm going to ask you this. What are the 3 branches of the aortic arch? If I do not get my answer in 1.5 seconds, I will decline treatment. I would rather succumb to my open wounds than be treated by a doofus who does not recall the 3 branches of the aortic arch. How can I even trust you? The 3 branches of the aortic arch are the brachiocephalic artery, left common carotid artery, and left subclavian artery, in this order. Brachiocephalic artery, left common carotid artery, and left subclavian artery. What does the word brachiocephalic mean? Brachium means arm, cephalo means head. So it will divide into 1 for your arm and 1 for your head. The one for your arm is going to be the right subclavian, which will become the right axillary, and by a verbal sleight of hand, it will change into right brachial, which will divide into right radial and right ulnar artery. That was the one for your arm. The one for your head is this right common carotid, which will then divide into right external carotid artery for your face and right internal carotid artery for your brain. But the left common carotid artery comes directly from the aortic arch, and the left subclavian artery comes directly out of the aortic arch as well, and not from a brachiocephalic trunk. Remember that the internal carotid artery will contribute to the anterior portion of the circulation for the brain, which is the circle of Willis, whereas the vertebral artery will give us the posterior aspect of the brain circulation. Anterior circulation, posterior circulation, together they make the circle of Willis. This is the aortic arch. The aortic arch itself has receptors that feel pressure, called baroreceptors. In the aortic arch, we have a carotid body of nerve fibers, and they contain chemoreceptors, which sense chemicals. So baroreceptors for pressure are in the aortic arch, but chemoreceptors for chemicals are in the aortic body. Similarly, here is the common carotid artery, which will divide into the external carotid artery for the face and internal carotid artery for the brain. The carotid sinus means a pocket, a dilated area, contains baroreceptors for pressure, whereas the carotid body of nerves contains chemoreceptors for chemicals. Today we're concerned with the baroreceptor reflex and not by chemoreceptors, so we're going to focus on the baroreceptors. How do I remember that the baroreceptors are in the sinus, whereas the chemoreceptors are in the carotid body? How can I tell the difference? By remembering the simple fact that pressure is nothing more and nothing less than force applied over a surface area. So pressure cares about area. So give it an area, give it a pocket, give it a dilated area for the force to act upon to give us a pressure. So the baroreceptor is in the wide area, the carotid sinus. The word sinus means pocket. In a university, we have all kinds of students. Some of them are studying economics, some of them are studying journalism, some of them are studying law, some of them are studying history, etc. All of these students put their hands in their pockets, but not medical students. Medical students put their hands in their sinuses. That was disgusting. Do you remember the sinoatrial node in the heart? Why do we call it sinoatrial node? Sino because it's a pocket. It's a pocket in the atrium, hence sinoatrial. If you have watched my video titled Anatomy of the Thorax, we have talked about these nerves in detail. Let me remind you that up here there is a glossopharyngeal nerve near your tongue and pharynx, but then the vagus nerve, which is cranial nerve 10, is going to wander all over the body. It includes head and neck and thorax and abdomen. This is the vagus nerve, which will give us the left recurrent laryngeal nerve, which wraps around the aortic arch. However, the right recurrent laryngeal of the right vagus winds around the right subclavian. So you wrap around the subclavian on the right, but you wrap around the aortic arch on the left. If you want to see more videos like this in the future, please drop a heart emoji in the comments. And if you have watched my neuroanatomy playlist, we have talked about the glossopharyngeal nerve or the ninth cranial nerve in detail. Remember, it had a bunch of nuclei, especially the solitary nucleus, also known as nucleus solitarius, which is so romantic. How come? Because it feels the changes in your blood pressure. The glossopharyngeal nerve is responsible for the carotid sinus and the carotid body. Carotid sinus for baroreceptors and carotid body for chemoreceptors. Where do I find the solitary nucleus? It's in the medulla, which makes sense because at the beginning of this video, we said that cranial nerves 9 and 10 and 11 and 12 emerge out of the medulla oblongata. So that's not surprising. If you wish to download these doozy colorful notes, go to medicosisperfectionalis.com. I help you learn, understand, and pass exams. If you want me to personally tutor you, reach out to me on my website. You know what else is not surprising? The fact that the vagus nerve also emerges out of the medulla oblongata. The vagus nerve too also takes origin from the nucleus solitarius, which is responsible for not the carotid this time, but the aortic body for chemoreceptors and aortic arch for baroreceptors. And we call these general visceral afferent fibers. Afferent from whom? From the aorta. Why do you call them afferent? Because they receive the impulse from the aortic arch and then they send the impulse to the brain. From the periphery to the center is the definition of an afferent nerve. So, the baroreceptor reflex is about cranial nerve 10 and cranial nerve 9. You find 9 in the carotid sinus and you find 10 in the aortic arch. I said sinus, not body. Arch, not body, because I'm talking about baroreceptors, not chemoreceptors. How are these receptors capable of feeling the pressure changes? Because they are stretch receptors. If they get stretched too much, it means that your blood pressure is too much. If they get stretched little, it means that your blood pressure is little. They are feeling the force by which your blood hits those special vessels. What's the purpose of the baroreceptor reflex? It's a protective reflex. For example, if you suffer from hypotension, The baroreceptor reflex will try to counteract this by raising your blood pressure back to normal. Conversely, if you suffer from hypertension, the baroreceptor reflex will try to correct this by lowering your blood pressure back to normal. Let's start with the first scenario where my blood pressure dropped for one reason or another. It could be that I lost volume, extracellular fluid volume depletion. And since the extracellular fluid includes intravascular and interstitial fluids, the intravascular is known as what? Effective arterial blood volume inside the artery, including these lovely arteries of the aortic arch and the carotid sinus. This will register as decreased blood pressure and will be felt by the baroreceptors as a drop in pressure because they will be stretched less. They will send afferent fibers to the medulla of the brain, #GVA, general, visceral afferent fibers. For the neuroanatomy buffs out there, this is called the Herring's nerve, which is not a red herring, it's actually important. And now we're part of the glossopharyngeal nerve, or the 9th cranial nerve. We're gonna reach the medulla, nucleus solitarius. And then, when you have hypotension, this is a dangerous situation that triggers your sympathetic nervous system. Fight, flight, baby, because I'm about to die. So I'm gonna send sympathetic fibers from the vasomotor area of the medulla, which is the rostral ventrolateral part of the medulla. Remember that the sympathetic fibers that reach the heart come from thoracic segments 1, 2, 3, and 4. T1 through T4 are the fibers that reach the heart, and because these are sympathetic fibers, they leave the lateral horn cell. What are you going to do to the heart? Well, I'm suffering from hypotension, so let me try to reverse this. How do you reverse low blood pressure? Remember that blood pressure is what? Well, blood pressure is cardiac output multiplied by total peripheral resistance. And cardiac output is what? It is heart rate multiplied by stroke volume. So, I'm gonna respond to the hypotension by trying to raise the heart rate, raise the stroke volume, and constrict the vessels to raise the total peripheral resistance so that at the end of the day I can raise the blood pressure back to normal. And this is exactly what the sympathetic nervous system will do. It will increase the heart rate, #beta-1 receptor stimulation, which is GS coupled. I'm going to increase cardiac contractility, #beta-1 adrenergic receptor stimulation, also GS coupled, which means it's going to increase cyclic AMP. And I'll also vasoconstrict your arterioles to increase the total peripheral resistance, #alpha-1 adrenergic receptor stimulation, which is GQ coupled, #calcium release. Calcium is the hero of contraction. Calcium contraction. Contraction of whom? Of the vessels. So they constrict, and when they constrict, the total peripheral resistance goes up, and the blood pressure goes up and back to normal. So the sympathetic response to the hypotension was tachycardia, boosting cardiac contractility, and vasoconstriction of arterioles and veins. When you vasoconstrict the arterioles, you're going to increase the diastolic blood pressure and increase the total peripheral resistance. And when you constrict the veins, you will boost the venous return and the preload to the heart, which is otherwise known as end diastolic volume for the right ventricle. The pressure has been regulated. The pressure has returned back to normal. And we call this a pressure buffer system. Which reminds me of what? Of the acid-base buffer system, which is used to buffer, i.e. minimize the change in pH. Pressure buffer system is similar. It minimizes the change in your blood pressure so that you may live. Conversely, what if I suffer from hypertension? Maybe because my doctor was a doofus who gave me too much normal saline, or for any other reason. This increases the effective arterial blood volume, which raises the blood pressure. So the natural response will be to try to bring the blood pressure down and back to normal. When the blood pressure is so high, the receptors are stretched too much. What receptors are you talking about? Baroreceptors. Where are they? In the carotid sinus and the aortic arch. Carotid sinus is by the 9th nerve, whereas the aortic arch is controlled by the 10th nerve. Afferent fibers, general, visceral, afferent or GVA, to the medulla again, nucleus solitarius. Then this time I'm gonna send parasympathetic because I'm trying to depress your blood pressure, not to raise it because it's already high. Let me send the vagus nerve, which is going to reach the heart. We'll try to decrease the heart rate, decrease the force of contraction, hashtag M2 or muscarinic number 2 receptors, which are GI coupled. GS for stimulation, GI for inhibition. And instead of vasoconstricting arteries and veins, I'm going to vasodilate the arteries and veins due to lack of sympathetic innervation. So, when I lower the heart rate, when I lower the stroke volume by decreasing the force of contraction, and when I dilate the arterioles, which means I'm gonna depress the total peripheral resistance, I will decrease the blood pressure back to normal. And this is the pressure buffer system, otherwise known as the baroreceptor reflex, which is magnificent. And if that was not enough, let me tell you something about ADH. If your blood pressure is so low, it means that you need to drink more water because water is volume. If you drink enough water, you can actually help bring the blood pressure up. So anytime you have hypotension, besides all of these responses, your hypothalamus is going to make ADH. Drop that into the posterior pituitary to be secreted to the outside world. And do you remember what ADH does? ADH has two receptors, vasopressin 1 and vasopressin 2. Vasopressin 1 will constrict vessels. Vasopressin 2 is antidiuretic. It tells the kidney to retain the water and not to excrete it. Conversely, if my blood pressure is so high, there is no need for ADH. So when the blood pressure rises, ADH stops. Let's take it to the next level. Remember that any reflex in physiology, and I mean any reflex in any system, has the following components: SRACEER. The acronym is Saracir, which is an Arabic word that means cockroaches. The S, stimulus, the R, receptor, then afferent, then center, which is part of your central nervous system, could be brain or spinal cord. E is efferent, E, effector organ, followed by the response. You start by a stimulus, and I give you a response. This is not a Pavlovian response. Instead, it's more fundamental than that. This is like the knee-jerk reflex or the patellar tendon reflex. Stimulus, response. There is no need for pairing or teaching or anything like this. This is automatic. You are born with it. By the way, why did Ivan Pavlov have such great hair? Answer: conditioning. So, here are the Saracers that we need: stimulus, receptor, afferent, center, efferent, effector, and response. Of the baroreceptor reflex, what's the stimulus? A change in your blood pressure. Could be hypotension or hypertension. If you have hypotension, you will stretch your baroreceptors less. If you have hypertension, you will stretch them more. The receptor, baroreceptors, where do I find them? In the carotid sinus or in the aortic arch. The carotid sinus is controlled by the afferent, known as the glossopharyngeal, whereas the aortic arch is controlled by the vagus nerve. Both of them, through general, visceral, afferent fibers, will hit the nucleus tractus solitarius, and then the solitary nucleus in the medulla oblongata. So where are we now? We are in the central nervous system, in the brain, in the medulla to be specific. Then, ventrolateral nucleus of the medulla is gonna trigger the sympathetic response to try to raise your blood pressure back to normal, and the dorsal motor nucleus of the vagus will do the opposite. It's vagus, so it's parasympathetic. It will try to decrease your blood pressure and back to normal. Efferent, well, we have fibers from the medulla, which will communicate with the sympathetic fibers, especially those who emerge from thoracic segments 1, 2, 3, and 4. This is if you want to raise the blood pressure. But what if I want to drop the blood pressure? Send parasympathetic fibers through the vagus nerve. To whom? To the effector organ. In the heart, I want to reach the SA node and the AV node to control the heart rate. If you started with hypotension, I'm going to raise the heart rate. If you started with hypertension, then the response should be to decrease the heart rate. Another effector organ are the muscles of the ventricle to increase or decrease the force of contraction. Another effector organ is the smooth muscle of the vessel wall, because I can cause vasoconstriction if the original impulse was hypotension, or I can dilate the vessels if the initial stimulus was hypertension. Response. Well, if the initial stimulus was hypotension, then I'm trying to raise the blood pressure by increasing the heart rate, the force of contraction of the ventricles, and the vasoconstriction of arterioles and veins. But if the initial stimulus was hypertension, then I'm going to do the opposite. Decrease heart rate, decrease contractility, and decrease vasoconstriction, which causes vasodilation of arteries and veins. to try to decrease the blood pressure back to normal. This was the best explanation of the baroreceptor reflex in the history of mankind, or as Justin Trudeau might say, people kind. Do you want to learn about angina, myocardial infarction, transient ischemic attack, stroke, cardiac arrhythmias, ARDS, acute limb ischemia, drowning, all of the toxidromes that you can imagine? Download my emergency medicine high yields course. It comes with videos, notes, and cases. If you found these videos to be helpful, please consider supporting my channel by buying me a coffee. Go to buymeacoffee.com/medicosis. You can see more videos in my physiology playlist. There are more than 600 premium videos available on this channel when you click the join button and choose the highest tier. Please subscribe, hit the bell, smash like, support my channel on Patreon, PayPal, or Venmo. Go to my website to download my courses, notes, and cases, or if you would like me to personally tutor you. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine, chemistry, math, and physics make perfect sense.